concussions. In our active world today, especially with our kids, especially since Sidney Crosby's case a few years ago, and the whole occurrence of problems in professional sports is quite a prominent condition to talk about. Sidney Crosby's case was quite interesting or drastic because he got treated after his accident on the ice for concussion only for, I think, 2-3 months, and he simply didn't seem to recover. And then one day, another doctor or physician or physiotherapist kind of investigated the potential for whiplash in his case, and that seemed to have been the case with him. So they then changed his treatment to actually include stretching, exercises, movement, and physiotherapy, which was previously for concussion not indicated. And then just 2-3 weeks later, he was back on the ice. No? So whenever there is, and today we kind of, when you talk to neurologists that work with concussion cases, you can almost rely that there's barely ever any concussion without an additional component of whiplash as well. What's interesting, and what also didn't help Sidney Crosby, was that whenever you have injuries within the fascia or ligaments of your spinal, of your cervical spine, these muscles tighten up, pull, and oftentimes create a so-called referral pain to the top of the head. And most doctors, when the pain site is here, they wouldn't necessarily look for the pain cause to be here. And so they think, oh yeah, it's still hurting up here, so it's still kind of concussion giving you grief, but it's actually so-called referral pain, which happens a lot in various other chronic pain scenarios. And by treating this with more stretching, physio, and specific exercises and nutritional support, this can be cured relatively quickly in many cases, not all. Then there's actually from our cooperation with CHIO, Children's Hospital of Eastern Ontario, the lead neurologist here, Christian Goulet, has developed a nutritional protocol that always includes omega-3 fatty acids at about 2 grams per day, EPA, DHA combined. He recommends, meanwhile, our bioactive B complex once or twice a day, depending on age and body weight. And he very strongly recommends our magnesium glycinate. And I want to point out here, he recommends a dose at 9 milligrams per kilogram of body weight per day. And to do the math for you, you don't have to do that. For the average 75 kilo teenage hockey player or football player, that means that they would use 4 of our capsules per day to achieve this dosage rate. And the average, although it might be above average, but 100 kilo adult, even though there's lots of 100 kilo teenagers as well, would end up following his recommendations with 5 to 6 capsules per day in divided doses taken morning, afternoon or evening, and bedtime.